Alzheimer's disease and other dementias profoundly impact millions of lives worldwide. This episode, accompanying therapy trainings course, Diagnosis, Treatment, and Care of Individuals with Alzheimer's Disease and Other Dementias, equips mental health professionals, counselors, and therapists with crucial insights. We'll cover key aspects of dementia care, from early detection to effective interventions, empowering you to make a significant difference in the lives of those affected by these conditions. Let's face it, dementia can be a daunting subject. It's complex, emotionally charged, and often misunderstood. But understanding it is crucial for anyone working in mental health. In this episode, you'll gain insights into diagnostic criteria, assessment tools, treatment options, and the importance of compassionate, person-centered care. We'll also tackle some common misconceptions and provide you with practical strategies you can apply in your practice. So, let's get started. First up, let's talk about diagnostic criteria and assessment tools. It's vital for mental health professionals to accurately identify and differentiate various forms of cognitive impairment. Alzheimer's disease isn't the only player in the dementia game. There are several other types, including vascular dementia, Lewy body dementia, and frontotemporal dementia. Each has its own set of characteristics and symptoms. The diagnostic criteria for Alzheimer's disease, as outlined by the DSM-5, include significant cognitive decline from a previous level of performance in one or more cognitive domains, such as learning and memory, language, executive function, and social cognition. But how do we assess these declines? That's where assessment tools come in. Standardized tests like the Mini Mental State Examination, or MMSE, and the Montreal Cognitive Assessment, known as MoCA, are commonly used. They provide a structured way to evaluate cognitive functions and can help distinguish Alzheimer's from other dementias. Keep in mind, though, that these tests are just part of the assessment process. A comprehensive evaluation should also include a detailed history, interviews with caregivers, and an understanding of the patient's daily functioning. Now, let's pivot to treatment and management strategies. In the course offered by therapy trainings, we explore evidence-based interventions that can make a significant difference. Pharmacological treatments like cholinesterase inhibitors, donepezil, rivastigmine, and galantamine are often prescribed for Alzheimer's disease. They can help manage symptoms related to memory, thinking, and reasoning. However, it's essential to remember that these medications are not a cure. They may slow the progression of symptoms but don't reverse the disease. But what about non-pharmacological strategies? Behavioral interventions and psychosocial support are equally, if not more important. Creating a structured environment, implementing routine activities, and providing cognitive stimulation can enhance the quality of life for individuals living with dementia. For instance, engaging patients in reminiscence therapy, where they discuss past experiences, can evoke positive emotions and stimulate memory recall. A key aspect of effective treatment is understanding the needs of caregivers. Caregiving can be incredibly demanding, and it's crucial to provide them with support and resources. This can include respite care, support groups, and educational resources that help them understand dementia and its progression. By supporting caregivers, we're ultimately enhancing the care provided to individuals with Alzheimer's disease and related dementias. Now, let's take a moment to discuss the importance of compassionate, person-centered care. This approach emphasizes the individuality of each patient, recognizing that behind the cognitive impairment is a person with a rich life history, preferences, and desires. Effective communication is a cornerstone of person-centered care. It's essential to use simple language, maintain eye contact, and be patient. Often, individuals with dementia may struggle to find words or may become frustrated. However, maintaining dignity and autonomy is paramount. Encouraging patients to make choices about their care can significantly enhance their sense of control and well-being. Let's take a brief detour to address some common misconceptions about Alzheimer's disease and other dementias. One prevalent myth is that dementia is a normal part of aging. While it's true that age is a risk factor, dementia is not inevitable. Many older adults maintain their cognitive function well into their later years. Another misconception is that individuals with dementia cannot understand what's happening around them. While it's true that cognitive abilities may decline, Many individuals retain their emotions and can be profoundly affected by their environment and the behavior of those around them. So, how do we address these misconceptions in our practice? Education is key. Providing accurate information to clients, families, and the community can help debunk myths and foster a better understanding of dementia. Incorporating family members into the treatment plan and educating them on the nature of dementia can create a support system that benefits everyone involved. Now, let's circle back to the idea of promoting dignity and autonomy in dementia care. It's essential to incorporate the values and preferences of the individual into their care plan. For example, if a patient enjoys gardening, finding ways to integrate that into their routine can provide joy and purpose. Remember, a person-centered approach is not just about managing symptoms, it's about enriching lives. As we draw near to the end of this episode, let's reflect on some thought-provoking insights. The landscape of dementia care is changing, and as mental health professionals, we have the opportunity to lead that change. By staying informed about the latest research and treatment options, advocating for our patients and their families, and embracing a holistic approach to care, we can make a difference in the lives of those affected by Alzheimer's disease and related dementias. I encourage you to visit therapytrainings.com, where you can explore more courses that delve into these critical topics. Continuing education is vital in our field, and Therapy Trainings offers a variety of resources to help you stay up to date and enhance your skills. In conclusion, navigating the complexities of Alzheimer's disease and other dementias may seem overwhelming at times, but remember, you're not alone in this journey. As we continue to learn and grow in our understanding, we can provide better care, support, and compassion to those who need it most. Thank you for joining me today, and I hope you found this episode insightful and empowering. Until next time, keep learning, keep caring, and keep making a difference.